Carpal tunnel surgery, also known as the carpal tunnel release, is in my opinion a fantastic operation for anyone who needs to have it, and I strongly recommend it. And I'm going to tell you a little bit about my experience with carpal tunnel surgery and, having developed carpal tunnel syndrome. Right here in the center of your hand, where I'm indicating, is the median nerve. The median nerve serves as sort of the information superhighway for sensory input data that is received from your fingertips. In other words, the feeling that you have in your fingertips and your thumb, that comes from signals transmitted along the median nerve to your brain, where you get the pain responses. But sometimes a condition can develop called carpal tunnel syndrome. And what happens is it's kind of like a tunnel cave-in or a partial cave-in. Your sensory inputs become blocked, and so you experience weakness, pain, and numbness in your fingertips and in your thumb. It's like a major traffic jam. Not just a traffic jam, but say a huge wreck where things are going to have to be pulled out of the way to clear the path, or a blocked tunnel. And you can feel things, but it doesn't feel right. Now, say I touch the edge of this computer, but I've got carpal tunnel syndrome. I can tell that I'm touching the computer. I can tell that I'm touching the monitor, but it doesn't feel like my fingers are right on the edge. It feels like there's some intervening material in between, like there's a blockage. And there is, in fact, with carpal tunnel syndrome, a blockage that's stopping me from feeling normal. And so I developed carpal tunnel syndrome. I was working at a poultry processing plant at the time, and I was doing a job that involved repetitive motion, and repetitive motion can be a big factor in the development of carpal tunnel syndrome. So I make an appointment with an orthopedic specialist. He sends me to another specialist who conducts something called a nerve conduction study. It's very simple. They apply electrodes to all of your fingers and your thumb on your affected hand, and then they transmit very mild shocks. Don't worry, it's not going to hurt you. It's very, very mild. You'll feel tingling sensations. After they get done with this series of shocks, they get a report that tells them how the median nerve is working. And chances are that's going to indicate very strongly carpal tunnel surgery. Now, with carpal tunnel, it's very important not to delay surgery if you need it, because if the pressure isn't taken off that median nerve for a very, very long time, you could in fact end up with a permanent disability and feelings in your hand that it would just never feel normal again. And so I take the results of the nerve conduction study to my orthopedic specialist, and he says, I need to get this done. You want me to do it Monday? And I say, fine. So I go in for the surgery. I'm lying on the table, having followed all the preoperative instructions. I'm lying on the table looking up at the ceiling. My right arm is extended over on another table where there's the doctor and the nurse, and there's also the person who's going to administer the anesthesia. Now, this might scare some people. I was not put to sleep for this, but I was given a regional or local painkiller which made my hand go completely numb. The surgery didn't take very long at all. The doctor makes a very small incision. I don't think it's even an inch. And right here is where the incision is made. And he performs a very straightforward operation to release the pressure off that median nerve. And then he begins to close. As the doctor was closing, as the surgeon was closing, I did feel a very small prick. I mentioned this to the nurse later, and she said, yeah, he was closing when you felt that. So you say they were watching me very closely in case they needed to administer more pain medication or something similar, or, adjust what he's doing in some way. But the surgery didn't take long at all, and I'm released, and the first day didn't hurt at all. Now, the next day, things get to be a bit of a problem. My hand is obviously bandaged, heavily bandaged, special bandages. I do have the use of my fingers, but I'm not supposed to pull, push, do heavy lifting, or anything that's going to put any strain on the median nerve. So I'm out of work for about 6 weeks. I experience pain because tissue damage, as in cutting into tissue damage is tissue damage. You are going to hurt from that. And I did take pain medication, but sometimes it felt as if I was just taking vitamin, because the pain, actually it was pretty sharp, but it wasn't so sharp that I wasn't able to function. There was this gnawing pain, but it didn't stop me from functioning as long as I was off work. And in fact, I took a nice trip to New Orleans during that period of time. Another area of concern was the fact that the numbness sort of continued. Now, the thing about that is you have to be patient, because as my orthopedic surgeon explained, you get back about an inch of normal feeling at a time. The normal sensory sensations, the normal feeling that you should have in your hand, it moves up about an inch a week. And so it takes a while for your feeling to come back. But it does come back. The pain goes away eventually as your hand heals. The feeling does come back. And at the end of 6 weeks, my right hand was as good as new. And it was like I'd never had carpal tunnel syndrome. And to this day, I can see a small scar right here, right here where I'm pointing. That's right where they do it. That's right where they make the incision. But the results for me have been fantastic. Yes, I did have to go through some pain. Yes, I did have to experience wondering if the feeling was coming back. And the reason for that was it comes back slowly. It's a gradual process. That's completely normal. Sometimes, that old thing about no pain, no gain, sometimes that really is true. Sometimes you'll need to have a procedure that's going to dramatically improve your quality of life, but to get from point A to point B, you will have to tolerate some pain. Am I glad I did it? Absolutely. I was in a situation with my right hand that wasn't going to get any better without some medical intervention. And I got the medical intervention. And following the surgery, I suffered some pain and some numbness for a period of weeks. But by the end of 6 weeks, it was gone. My right hand was normal. To this day, it's as good as new. Now, I'm not the best typist in the world, nor am I the best piano player in the world by any means, but I'll say this about that. I can hit the wrong keys with the best of them, and it doesn't hurt me in the slightest. And, I was willing to go have that surgical procedure that dramatically improved my quality of life. I do recommend that for other people. Strongly recommend it for other people. And as I said, it's important not to wait too long, because if you wait too long, you can end up with a permanent disability. And normally there's no coming back from permanent disabilities. And so there is my description of carpal tunnel surgery. It is a procedure that I wholeheartedly endorse and strongly recommend. You will have to talk to your doctor for specific information as it applies to your case. But in general, if you're in a situation like I was with that carpal tunnel syndrome, I do recommend the surgery, and I believe that it most likely will dramatically improve your quality of life. It certainly improved mine. And there's the lowdown on carpal tunnel surgery.